Hi, I'm Dr. Ng. I'm an ear, nose, and throat specialist. What I'd like to share with you today is the problem with elderly people, their hearing health, what are the problems with their hearing problems, and how do we help them to improve their hearing and then their quality of life. So the anatomy of the ear consists of the outer ear, the ear canal, the eardrum, and then in the middle part, it has the eardrum and the middle ear bones, and then the inner ear is the cochlea that consists of all the nerves, and then finally the nerve that conduct electricity to the brain. So in the elderly people, there are many different types of problems that can encounter causing hearing loss. For example, there might be something impacting the ear canal, causing a conduction of sound problems. There might be a problem in the middle ear, including a perforation of the eardrum, or there could be fluid in the middle ear impeding movement of the middle ear bone. But oftentimes we see problems in the cochlea because of the aging process. We lose a lot of hearing cells and also nerve with degeneration, and therefore the hearing become diminished over time, and the electricity going to the brain goes down, and that contributes to the hearing problems. In the elderly people, there are many different types of problems that can encounter. For example, there can be something impacted in the ear canal, or could be fluid in the middle ear space, blocking the conductions of hearing. But oftentimes, we often see that because of the aging process, we see degenerations of the nerve and the cochlea, leading to diminished electrical signals to the brain, and that's how they lose the hearing. So over the next couple of sessions, we're going to talk about what are the symptoms associated with hearing loss in elderly people, and what are the ways that we can help them in terms of amplifications, and talk about different ways that caregivers can help to contribute to better hearing and a better quality of life. Hearing loss is a very common problem. As we get older, we get degeneration of the nerve. It's just like anything else. It could be eyesight, but because of the degeneration of the nerve is causing hearing loss. Oftentimes, and in fact most of the time, hearing loss is a gradual event. So what happens is people tend to find that it's getting more and more difficult to hear, having difficulty conversations, listening to people in a very noisy environment, and oftentimes they might have difficulty understanding speech when they watch TV or having a conversation. So if that is a gradual event, then they can probably slowly try to adapt to it. But in some situation, it can happen in younger people, it's a sudden hearing loss. Now, sudden hearing loss can be due to a variety of reasons, and also in elderly, is that all of a sudden one side of the hearing drops. So in that situation, people will notice it very acutely. For example, they might say, they wake up in the morning and they find that they cannot hear. They pick up the phone and they find that one ear can hear better, and they have to switch over to the other side. So those are the two common scenarios that can happen to elderly people in terms of the hearing loss. In fact, hearing loss is a very common problem in the elderly populations. As we get older, the nerves in the cochlea, the inner ear, will degenerate. And when the nerves degenerate, we'll begin losing our ability to hear. So generally speaking, in the low frequency means that the sound will tend to be a little bit lower tone. And it's the last one that we lose as we age. And in the middle part, it has some relationship to noise exposure. So as mentioned before, if we, during the younger day, when we expose to a very loud noise, listen to a lot of loud music, we begin to lose a lot of mid-frequencies. But the high frequency is the most susceptible to aging, because the nerves in the high frequency range tend to be very fragile, very easy to have exposure to infections and degeneration. So in this diagram, it's a very typical picture of a person with age. We tend to lose high frequencies. So oftentimes for elderly people, they begin to notice that increasingly they become very difficult to catch up what they hear out of a social environment. It becomes even more difficult, especially in a very noisy place. They might have difficulty with the volume. They have to turn up the TV higher. When they go to a very noisy place or having dinner in a restaurant, they become very difficult to understand speech. This is all related to the fact that we're losing more and more high-frequency hearing loss. So the only way to rehab that is to amplify some of the frequency deficiencies in the high-frequency range. So hearing loss is a very common problem as we get older. But unfortunately, hearing loss can lead to many different problems. For example, the loss of hearing means that we have the difficulty listening to sound, music, interact with other people, with family members, with this ability to able to discriminate sound, make it very hard for us to understanding speech. So over time, there are lots of other problems that can associate with hearing loss that we are not even aware of. For example, we can become very depressed, we can be isolated, we might become very annoying, very irritable. We don't want to interact with family members, and likewise family members find us very, very difficult because we are unable to interact because of the lack of hearing. So a hearing loss over time with aging is a major issue that we need to deal with. We need to address the issue in a positive way. Hearing loss as we get older is a very common problem, and we just have to face it positively. For example, if you have difficulty understanding speech or listening to music or difficulty with TV interaction with the family members, you should bring it up. The first thing you need to do is talk to the family doctor. You say that you have trouble listening, and obviously we need to rule out all the major obvious problems. Like if you have an infection, you have earwax, they need to be removed. If you have an infection or fluid in the middle ear, we need to remove the middle ear fluid. But oftentimes, as we get older, because of the degeneration of the nerve, we lost our hearing. So the best way to handle hearing loss is to use a hearing aid. There are many different types of hearing aids now, and the technology is so advanced that the ability to allow us to have better listening, better volume, and also discriminate better is much better than the hearing aids 10 years ago. For example, if we don't listen if we have hearing loss, we lose the ability to transfer information to our brain. So oftentimes as we get older, we become more and more difficult with understanding speech, and our cognitive function goes down. So the hearing aids not only to amplify the sound, but the hearing aids also help us to perceive more sound transferring the information to our brain to keep our brain very active, and therefore delay the whole process of aging. So in the next sessions, what we are going to do is we're going to talk about different types of hearing aids and see how they can benefit us. So in this diagram, we basically show you the different types of hearing aids. For example, there are some hearing aids that are so small that they put it in the ear canal that you can hardly see it. But as we increase the size of the hearing aid, obviously you will see a bigger filling of the so-called the concha bowl of the external ear canal. And then some of the hearing aids are designed to hook behind the earlobe with a little wire that swing forward and insert the little probe going into the ear canal, such as these one. The differences between these hearing aids also is the fact that they can sometimes put the amplifier and the receiver in different part of the hearing aid. For example, in this particular model, the amplifier, the receiver are separated, and so that they can make the sounds much clearer as opposed to putting everything into the single modules. But there are different benefits of having the two units in separate locations versus one in this area. So when you speak to the audiologist will tell you which types of hearing aid out of all of these different choices will fit you. The different hearing aids are so advanced now, the technology is so good, it also aims to amplify based on using a different programming to tell you to amplify a different part of the hearing frequency so that it fits exactly the types of hearing loss you have. The audiologist will also tell you whether you are more suitable to have a hearing aid that fit right into the concha bowl, or whether you should have a hearing aid that goes behind the ear. So audiologists will program the hearing aid, give you much better choices and give you more advice on the types of hearing aid to be used. As a patient, it's very important to use the hearing aid on a regular basis to optimize the hearing ability so that the brain can function as long and as frequent as possible. Now, as a caregiver to the elderly people, it's very important to identify many different problems. For example, the caregiver should make sure that the hearing aid is used properly. The position of the hearing aid is very important to make sure that the person can get the maximum amplification. Oftentimes, the elderly people will not be able to understand or able to recognize that the difficulty with hearing is not just, it could be a problem with the hearing aid. It could be issues with the ear canal. For example, there might be some wax building up around the ear, around the hearing aids, and the caregiver would be able to identify it. At the same time, sometimes the elderly people stop using a hearing aid because there might be some irritation on the skin, there may be a little bit of an infection of the ear canal causing discomfort, and so they stop using the hearing aid. So the caregiver would be able to identify the problems or even help to put medication on the ear canal to make sure there is no skin irritation. Sometimes checking the hearing aid by the caregiver is also very important because the caregiver would be able to identify whether the batteries are working, the hearing aids are providing the maximum amount of amplification. Even the positioning of the hearing aids is important. The caregivers also has a very important role to identify whether the patient, the elderly person, is responding to the hearing aid's amplification. If the caregiver noticed that the elderly person is not responding or properly or optimally, even with the hearing aids on, it may be a mismatch between the severity of the hearing loss and the amplification. So in that situation, that hearing aids need to be repaired or rechecked. And finally, the caregiver should remind the elderly people to have the hearing check every year, to monitor, to make sure that the hearing loss is not getting worse and worse, and then the amplification using a hearing aid are matching the types of hearing loss that they have.